Hello and welcome to HealthexecTV. I'm now joined by India Hardy, lead pharmacist for EPR prescribing at Chelsea and Westminister Hospital. India, thanks for coming in today.
Thank you.
Firstly, India, tell us why Chelsea and Westminster decided to move to an e-prescribing system.
Firstly, because it was aligned with our corporate objectives of delivering the highest quality of care, but also due to some national initiatives that were happening around the same time. So a Spoonful of Sugar report had just been released indicating that automation within the medicines management space would improve patient outcomes, and also with the National Programme for IT that was just starting off at the same time.
So what benefits have been brought about as a result of the introduction of e-prescribing?
Patient safety benefits have included reduced incidence and reduced severity of medication errors. Clinical effectiveness benefits include the prescribing of thromboprophylaxis in line with the guidelines for prevention of VTE, and patient experience benefits have included the transfer of information in discharge summaries between the interfaces of primary and secondary care.
In particular, what are the tangible benefits of using First Data Bank's multi-lex drug data file for clinical decision support? Can you share any statistics with us?
Sure. So in 2007, the NPSA reported that 3.2% of medication incidents were related to patients being administered a medicine to which they had a known documented allergy. And what we found with our system is that introduction of the clinical decision support using the multi-lex drug data file reduced that by 77% from before the system was introduced and afterwards.
And how did you manage the rollout?
The rollout of electronic prescribing really had about 6 key elements to it. The first thing was defining the scope and working out what it was that we wanted to achieve, then getting both the software and the hardware right, engaging the stakeholders across the hospital, planning the actual go live and implementation, including the training packages, and then making sure that we realised all the benefits that it had delivered.
And finally, what are the next steps for Chelsea and Westminster?
The next steps for Chelsea and Westminster are around improving the clinical effectiveness of care. We have ambitious plans around our thromboprophylaxis and making sure that the patients get the correct medication prescriptions to ensure that we don't get any VTEs. We also are committed to making sure that any patients who are at risk of renal impairment are identified and get the correct dosages in their prescriptions.
India Hardy, thank you very much.
Thank you.